but so glad to have you here. My name is Dr. John Nasser. I'm the President and Chief Medical Officer for Optum Tri-State, which Krista Run is a part of. But more importantly, I'm a Krista Run physician and have been with the practice for 22 years. And one of the things that I love about Krista Run is that we have a great team and physicians and APCs, nurse practitioners, nurses and staff and marketing, our marketing team, of course. And we wanted to talk tonight about one of our teams that's been growing, and that's our sports medicine team. And we're excited to talk to you about a new service that we're offering for athletes that we wanted to share and thought you would be interested in learning more about. So I'm going to introduce, or actually let a few of our physicians introduce themselves as part of our sports medicine team. But if you've been on any of our webinars before, as you might know, I like to ask like a little kickoff question for them when they introduce themselves. And today is a really important day in sports. So it's a timely call tonight. Today is the first day of March Madness. So some of you may be college basketball fans. One of our doctors played college basketball. So my question, though, for Dr. Conway and Dr. Hulse as they introduce themselves is the following. What team would you like to win March Madness? And what team do you think is going to win? So again, I shared briefly, I'll just kick off. Again, John Nasser. I'm a pediatrician and internist in my free time. And by the way, so excited to have both Jeff and Justin here. I've shared many patients in common with them over the years. So the team that I would like to win March Madness, I'm wearing their color today, are Duke Blue Devils. We're a Duke family, have gone to school there, my wife, myself. But I don't think they're going to win this year. I think UConn is just dominant and expect them to be cutting down the nets in a few weeks. So I'll turn it over to Dr. Conway next. Justin, please introduce yourself. Tell us what you do here at Krista Run. And then we're going to get into the CPET testing after introductions.
Great. Yeah, thanks. I'm a family medicine physician with a board certification in sports medicine. Lifelong athlete, still trying to stay out there and stick with it. Yeah, in my eyes, this is a national holiday. So thank you everyone for joining us on the first day of March Madness. Already one upset. It was Duquesne over BYU. More to come, I'm sure. Sadly, my alma mater, Princeton's not in it this year. The last year they did go to Sweet 16. I hope that UNM, University of New Mexico, wins it. That's where I grew up, in Santa Fe, New Mexico. Go Lobos. They're an 11 seed though, so it's a stretch. I'm gonna go with Tennessee. They looked good throughout the year. They faltered in the SC tournament, but I think they have a run in them.
Awesome.
Hulse.
And Justin, give us a little background on the sports medicine department before we get into the testing, just since that's your domain here. I'd love to share with everyone what we do.
We're a growing department of primary care sports medicine physicians. We're non-operative with backgrounds in family medicine and internal medicine. Currently, there's 4 of us, with one more joining over the summer. He's currently finishing his fellowship down in Auburn, who also could potentially win it. And yeah, we're kind of see a wide-ranging variety of sports injuries and musculoskeletal complaints, and also more of the medical side of sports injuries, such as concussions and cardiovascular issues, respiratory issues, things like that. And we're in all our offices from Rock Hill down to West Nyack.
Great, thanks, Justin. So one of the things that I think differentiates us at Krista Run is we have great doctors. And not only that, we have a culture of doctors who work together across specialties to deliver care for our patients. So this is a really great example with this new test of 2 different specialties coming together. And so I wanted to next introduce Dr. Geoff Hulse, who is one of our pulmonologists. And you may wonder why he's on the sports medicine discussion, and he'll explain that. But I also want you to sort of hear, as I'm sharing that, how this came together across these 2 physicians in different specialties at Krista Run.
Yes, hi everybody. My name is Geoff Hulse. As John says, I am one of the pulmonary critical care physicians here at Krista Run. I've been with the practice here for 15 years, and so I pulmonary medicine because really I was always interested in the physiology of the pulmonary system as it relates to the environment and what we do on an everyday basis. Essentially, without your breathing, you cannot live. So it's a very vital organ. So that's kind of why I kind of went into it. We from a pulmonary standpoint, athletic conditions that a pulmonologist might see include like asthmatic type of conditions, people with chronic cough, or more likely unexplained shortness of breath due to various reasons. I've been doing CPET since about 2003. There was a brief hiatus when the service wasn't offered locally. I've worked with professional sports teams as well as patients with respiratory, cardiovascular, and neuromuscular diseases, and did research in CPET. So it's something that's near and dear to my heart, and I'm very excited to have this service available now. As far as the basketball tournament goes, I don't follow it very much, but I would say that I'd heard that, a local team that is an underdog, Wagner, was involved, but I don't know if they played yet.
They already lost, unfortunately.
Okay. Well, I would want to see Wagner win, but I agree with John. I think UConn's a team to beat.
Great. And Jeff, share one other bit of trivia about you. What professional sport did you
Oh
play?
yeah. So I actually played in the New York Islanders organization in the minor leagues as a hockey player, which was a very exciting time in my life.
All right, great. Well, great to have both of you guys. So I'll turn it over to either of you to first just let us know what is CPET, what does it stand for, what do we do, and tell us more about why an athlete might consider coming in and having this testing done.
Jeff, you want to explain CPET, and I'll talk about the athlete side.
Sounds good. So CPET is a dynamic, it's a non-invasive assessment of the cardiopulmonary system at rest and during exercise. And its main focus is determine functional capacity for an individual. For athletic purposes and training, as well as underlying illness, which I'm more familiar with the illness part with Justin doing the more of the athletic training part.
Yeah, so from an athlete's perspective, I think, it can be very valuable. So it stands for Cardiopulmonary Exercise Testing. Many people may have heard of it as VO2 max testing, which is one of the main outcomes of the test, but that's definitely not the only thing that we're testing. So starting with VO2 max, you can think of it as like the capacity of your engine. So really it's testing the ability and efficiency of your body to deliver oxygen to your muscles during exercise. And we do that by measuring basically the oxygen you're breathing in and the carbon dioxide you're breathing out through a mask that's then hooked up with a tube to a machine that analyzes everything, while also analyzing your heart rate and oxygen saturation and a lot of other parameters. So one, for an athlete, it's a good test to see where you're at fitness-wise. Two, for people who are training or thinking about getting into training for a race, such as a marathon or triathlon or what have you, it can be a great way to sort of help design your training plan. One, to know where you're starting from, and two, to give you some parameters about basically like to carve out what are your different zones. And by zones, we mean what's your aerobic threshold, what's your anaerobic threshold, what's your heart rate at those thresholds. And so by specifying that, then you can design a workout plan or a training regimen based around those heart rate zones to help achieve what you want to achieve, depending on how long the race is, the intensity, things like that.
And Justin, what kind of an athlete? Is this like a weekend warrior thing? Is this like a marathon runner? Like who do you view as the athletes that would get sort of the most out of having this testing done?
So I would say any athlete, and with a wing to our marketing department, we're all athletes of life, so could be anybody. But seriously, it's definitely more for like the endurance type athlete, or that's sort of the kind of the key population I think would be most interested in. Anyone who's, yeah, as I said, like would be potentially just wants to assess where their fitness level is. One, and two, would like to know more about like kind of where their zones are, which based on actual data and not just the estimates that you get on your Garmin watch or your Apple Watch or something like that, but it actually is specific to you. And then you can use that to really make your training plan. And then ideally you would then retest to one, see how your fitness level changed over time, and two, how your training program worked and if you need to tweak things here or there.
Great. So Jeff, when you have somebody come in for the test, what do they do? Like how hard do you, like what kind of exercise do you put people through? I'm a Peloton rider in my free time, and I like to do um, oh my gosh, Matt Wilper's rides, and actually they have you do an assessment or do a 20-minute ride at like all out, which I can't stand doing, to assess your capacity, and then you sort of use that for your training zones afterwards. I'm just wondering, like, is that as hard as you exercise? Like, what do you expect for folks when they come in and they might see you or see our exercise physiologist to put them through the testing?
Yeah, yeah, it's pretty close to that. We really want them to give an all-out effort so we can get the most quality data possible. So yeah, when you come in to do the test, expect that you're going to get a pretty hard workout. And if not, then we're not pushing you hard enough because we really gotta get you into your uncomfortable zones to get good results. We do a bicycle ergometer, so we do not do a treadmill. So yeah, so it's most likely in line with what people are used to. And the reason the bicycle ergometer is so good is it actually will actually know how much power you're putting out, how much watt you're putting out, which we can't really get as great with the treadmill. So it is definitely the bike I think is probably the most reliable method to do the test. Yeah, I mean, it's set up where, it's a comfortable environment. You wear comfortable clothes. So it should be pretty easy to do.
And then Jeff, what's the output from like when you're reading the test? Because I know I've heard you guys explain, Justin might be seeing an athlete and order the test. We do the testing. We do it in our Newbury location. And so Jeff, when you're reading the test, like what are you seeing and what is the result that somebody might get?
Well, I think the first thing we'll look at is to see what kind of effort is given, and that's important. So, if the patient has reached an aerobic threshold, then they've given a good effort. But the key parameter we're looking at when we're reading these tests, ultimately, the first parameter we're looking for is the actual oxygen consumption. How good is that? Because that's really what's the most important parameter. Once you have, if you have a normal oxygen consumption, that means that, all your systems are working pretty well, maybe not as well as you'd like them to be. And that's why you'll probably, train if you're an athlete. But if it's below what's expected, then, we're looking at trying to narrow down to certain diseases that might be causing the problem.
So when you have an elite athlete that's coming in, say a marathon runner versus a person who might be recovering from pneumonia or I don't know, COVID or some prolonged respiratory illness, if we were to test them, what is the difference? Does an elite athlete have a super normal O2 consumption? Like how do you, if you were to just look at a test and say, I kind of know what this person must be like, what do you see on the testing that helps you figure that out?
Yeah, I mean, you'll see like a trained athlete, they'll get a very high VO2 max. they may have a lower heart rate response when they exercise because they're more trained. Those are probably two of the bigger things that you might see as compared to someone who's sick or deconditioned. Then you'll see the opposite.
Yeah. Okay. And then when the test comes back to you, Justin, what do you do with the results? And then when you have a patient that you might be working with, how do you interpret them, and what do you tell them to sort of do then moving forward?
Yeah, so that's kind of built into our protocol where the patient, well, first, in most cases, would meet with me to discuss the test and the reasons for doing the test, and also will order, as indicated, blood work to assess things like your iron levels and blood cell counts and like other electrolytes and things like that that can impact performance. And then we'll go for the test, and then Jeff reads and interprets the report, and then it goes into your chart, and then he'll follow with me after, at which time we'll evaluate the findings of the report. I mean, it does give you, so for example, for your VO2 max, it will give you what that is based on like an age-matched control. So for an athlete, you'd expect to be at close to or above 100% of what an age-matched non-athletic control is. But then there's other, tables or guidelines based on what you would expect for an athlete. So we'll kind of use the report, which is more generic and not geared towards an athlete per se, and then kind of translate into more like an athlete or performance lens. And then I think what's most helpful for most athletes, and again, it varies a little bit about what the goals are, is to look at your aerobic and anaerobic threshold and what your heart rate is at those levels. And because that's what really gives you your zones. And you can also see that's also an important thing to assess and compare, because what I've learned as I'm like, gone more into this space is that for your aerobic threshold, you want that to be around 55 to 65% of your heart rate at VO2 max, and your anaerobic threshold more like 85 to 90%. So your VO2 max would be great, but if your heart rate, if you're getting up to your aerobic threshold, at like below 50 or 55%, then that's a sign that maybe your baseline endurance is not good enough. And then you should really focus on that. Or if your VO2 max is lower than expected, or if your anaerobic threshold, your heart rate at anaerobic threshold is lagging compared to your heart rate at VO2 max, and that's a sign that you would need to do more like high intensity interval type training. So I think that's where it really gets helpful to dial in on those things to help guide people's training.
So Justin, give us an example of, let's take a marathon runner, probably the one we think about a lot for endurance.
Mm-hmm.
And let's say, if somebody did a marathon and they ran it in 4 hours and they want to do 3.5 hours. How would walk us through, if they came into you with that question, I want to improve my time significantly. How would this test help them, and how would you help them then design maybe a different training program that would help them achieve that goal?
Yeah, I guess so. I'd start with asking about the race, like if they felt like, was their pace just overall too slow, or did they sort of bonk at the end? And then obviously think about there's so many things involved. Nutrition, that's where some of the lab work can be helpful. What was their training program like leading up to the race? Yeah, and then that's, like I said, depending on if what their VO2 max is compared to an athlete control population, compared up, like looking at their aerobic and anaerobic threshold compared to an athletic population, then one answer would be, well, your base endurance could have been better, or like your base endurance was actually pretty good, but it seems like your VO2 max could improve, or anaerobic threshold could improve, so you can really like get that burst at the end or push through those last few miles. So you should be focusing more on like high intensity interval training as opposed to just like getting your miles in.
Got it. And if they were to test again, like let's not just a marathon runner, like how often should somebody come back and have another test?
Yeah, I think realistically, a 6-month interval between tests is probably
Okay.
realistic to give yourself time to work on something, and then, and also time for your body, your physiology to change because of it.
And then one other question, and then I'll just stop asking questions, and you guys can tell us anything else, and we'll open up for questions as well. Just logistically, how does somebody get this test done? What do they need to do, or do they call for an appointment with you, Dr. Conway? Tell us about, someone wants to get
So
this
I think
done. What do they
there's
do?
various ways, including calling the generic Quistro number and asking for an appointment with me to discuss exercise testing. I believe there's also on the flyer, there's a contact info for Sarah Pagan, who's the director of orthopedic services, and so that's the main administrative contact. We are, in the future, we'd love to have groups come in or offer group rates or discounts. So that's something that Sarah Pagan and her team could discuss with people who are interested.
Great. Okay, thanks. And what else should we know about CPET? Either if any of you guys want to, Justin or Jeff, want to give us some closing comments that I may have forgotten to ask, and then we'll open up for questions.
I think an important point, and just, for transparency, is for the sports performance side, it's not covered by insurance. If there's medical indications, then that, like unexplained shortness of breath, for example, then that's something insurance would cover. So the initial visit with me would be more like a sports physical, and that would go through your insurance. But the test and the follow with me to interpret the results, currently the pricing is $650 for that test, plus the follow-up visit. So that's important information to share.
Yeah, absolutely. Jeff, anything else that you'd like to add?
I think from my point of view, like any test, it's just an extra piece of data or an extra tool in our tool bag that will help us, along a full range of, what it is we're looking into. So know that, this test, is very important, but it's just a little diagnostic in our tool bag.
Great. All right, well, we will open it up for questions. I understand some people are actually on, I can see you, and you can come off mute and ask a question or raise your hand. And then I think some may be putting questions into the chat.
Dr. Conway, you mentioned that the intervals are about 6 months or so for in-between testing. And is there something that the athlete or the person can do in between to kind of self-monitor their progress? So heard stuff from, let's say if you're on the Peloton, it could be, I think watts per kilogram or whatever you're looking at. But is there a way that I can see if I am progressing before that 6-month checkup or that 6-month retest?
Yeah, that's a great question. Yeah, I think so. Now, like a lot of the watches, like I mentioned before, have your VO2 max on their estimation, which I will say in our both in terms of looking into the research and the tests that handful of tests we've done so far, the watches are always overestimating your actual VO2 max. Like on my Garmin watch, it overestimated by more than 10. But if you're comparing apples to apples, then that could be a helpful way to monitor, even if it's not accurate. You know what your baseline is on your watch, and you could test that. But yeah, I would say whatever you're doing, just use the same things.
Makes sense. Thanks.
So Steve, just on your question, I couldn't remember earlier, but it's the power zones on Peloton that you can test and retest again, and the 20-minute VO2 max sort of corollary test is the one that I have to tell you is so hard, and I avoid it. But you can retest on there at least earlier and see how you're doing. I've done that in the past.
That's probably why I haven't done it yet. Makes sense then.
That's a tough one. Just wanted, Steve, thanks for being here. Steve is one of the owners of Access Physical Therapy, a great partner of ours at Krista Run. So wanted to thank you for joining and all of the great care you've taken of our patients as well.
course, thanks.
I think you shouldn't be afraid of it. It's a very common test. We exercise all the time, and that's essentially what you're doing. And it'll give us some important pieces of information that will include information specifically about his heart too. So it'll be
Yeah, exactly.
So I think
Okay.
in that particular case, it's, for medical reasons, it might be a good thing to do, especially if he's short of breath or he feels like he's not up to the same standards he was, before he got ill.
Yeah, no,
I can speak to that. I had the opportunity to test it out myself. And so, yeah, you come in and do the pulmonary function testing beforehand at rest. And for that, you have like a nose clip on, and then you're breathing into to a mouthpiece. And then for the test itself, you have EKG monitors on your chest. And then you have a mask that fits around your head. But your mouth is open. I've seen like older models, you had to like basically breathe into a mouthpiece the whole time, but in this one, it's a tight-fitting mask around your nose and mouth, so it's much more comfortable to exercise in. And then there's a couple of minute sort of ramp-up period, yeah. And then from the tests I've seen, including my own, it's about 10 to 12 minutes of high effort to get people to their max. And the bike is set to a certain protocol so that every minute or so, it's automatically increasing the resistance. And also there's a monitor on the bike, on the stem of the handles, that's telling you what your minimum RPM there should be, so how fast you're pedaling. And then so that's increasing too. So the resistance going up, it's asking you to pedal faster and sort of barking at you if you're not. So it gets you tired pretty quickly.
And do you, as the athlete on the bike, are you seeing all that data while you're going through it?
No, I mean, there's the machine over there, and the exercise physiologist is kind of managing that, but you're just focused, basically all you're looking at is what your cadence should be, and then you're just feeling the resistance increasing.
And so who calls it done? How do you know?
Yeah, that's a good question. So the exercise physiologist is watching your blood pressure and your heart rate, and there's parameters like at this level, the test needs to be stopped. But usually it's based on your perceived effort. So every couple minutes, the physiologist is asking you, like on a 0 to 10 or 0 to 20 scale, depending, like how hard is this? So 0 being you're just at rest, and 20 being like, I cannot possibly do, one more second of this. And so generally the test ends once you get to either you yourself call it, like, I can't go on anymore. I mean, that's basically, I guess, how it ends, is you say you can't go anymore.
Okay.
Unless medically it gets dangerous based on your heart rate or blood pressure.
Yeah, that's correct. I mean, I think he's right. It's up to you to make the call, and you'll know when you're done. And that's when, there are certain parameters that we look for that might be dangerous for you to proceed, but you're going to make the call. And the RPM actually is set. You usually keep it around 50 or 60 RPMs, and then the resistance builds on the bike. So you're supposed to keep it around the same RPMs the whole time.
Interesting. For mine, it actually did. It asked me to go up, but sounds like we should talk about that offline.
Okay. And then, can I just say one more thing? And I know, Justin,
yeah, of course, Jen. Yeah.
When I see, but so this is on the bike, and I know you guys this is all new, but I mean, heart rate. I know for me personally, my effort and heart rate is very different on the bike versus my run. So you're saying that the data on the bike is really going to give you the same information needed for, versus a cyclist versus a runner?
Yeah, I think that's a good point. And for a variety of reasons, your VO2 max on the bike is not going to be the same as your VO2 max on the run, or your VO2 max, swimming, for example. Because we all are exercising at different efficiencies, depending on what we're doing. However, the data is still valuable. And again, you can say, even if you were just running and not biking, it's valuable to get your CPET on the bike, and then would also be valuable to repeat it to see how your training is working. Because again, you're comparing apples to apples.
Gotcha.
Dr. Hulse, there was a question that I think you could answer, which was related to whether there's any blood testing done during the test to assess lactate levels. And I think maybe just help us understand, because I think I know the answer to that. If the answer is no, how do we know what anaerobic capacity is as people are doing this test?
That's a great question. Typically, we're not really drawing blood levels or having an indwelling A line for these for the type of procedures that we're doing, but we can get pretty close to seeing where you're at with like what we call the anaerobic threshold, which means that's when you're starting to build up lactic acid in your blood, and then your homeostatic mechanisms are not maintaining it. So we're looking at that anaerobic threshold. We see that with the testing that we do with the gases that we measure with you breathing. But it's fairly close. But if you wanted to be really perfection about it, yeah, we would take lab work specifically for that. And also, if we had the ability to measure dead space volume, which is important with people with pulmonary conditions, we would definitely need to have blood gases in that sense. But specifically for the lactate threshold, I think that's something that's very common with the athletics, right, Justin?
Yeah, I mean, it's so your lactate threshold and anaerobic threshold are generally about the same. So we are basically estimating your lactate threshold based on your anaerobic threshold, like you said.
Thanks. Yeah, and I think Jeff, you had shared with me in a prior discussion that the putting lines in and is more sort of a research protocol than at least, or maybe, I don't know, maybe you guys did that with the professional athletes, but it sounded like that wasn't very common that you would be, having a line in place while doing a test like this.
That's correct. Yeah.
One other question that I had, just if you guys could help one of you maybe start with Justin. So you were talking about sort of aerobic, anaerobic thresholds and zones. How does that correlate with zone training? And I think people may have heard about sort of what level of exercise they should be training at in order to lose weight. So is that at all related here? And if someone's looking to exercise to lose weight, at what kind of aerobic, anaerobic sort of capacity or exercise level should they be doing? Just totally unrelated. We're using some of the same terms. Can you tell us a little bit about how that's relevant here or not?
Yeah, I think the first part of the question about zone training, yeah, I mean, it's definitely becoming really popular. And if anyone's been to Orange Theory, like your zone is up on a screen, everyone can see it, and you're getting your flat points or whatever it's called. But yeah, I mean, this is similar in that, so zone, really what a zone is where are you on the spectrum from rest to, you've gone to your aerobic threshold, your anaerobic threshold, and then your max, your VO2 max. But that's all just in those settings based on like a gross estimate based on your age and maybe your like height and weight and stuff like that. But this is actually getting physiologically what those parameters are and how the zones are created. In terms of weight loss, to be honest, I'm not an expert in that field. I think everyone, any exercise is helpful, and it's a bit, based on the individual. I think I'll just leave it there.
Yep, that's fine. The reason I bring it up, Justin, is there's some, I don't know how good the data is, but I've often talked to patients about who are exercising and to lose weight and not being successful. And I think a general thing you may have heard or people talk about is not exercising to breathlessness. but exercising to be able to talk in 3 to 4 word sentences. And I think, although I don't know, that is sort of correlated with the zones that you were talking about. And sometimes we talk about sort of, exercising between, in the Peloton world, zone 3 and 4 is sort of threshold, which is, the difference between aerobic and anaerobic threshold. And again, it's all sort of an estimate. So the reason I bring it up is sometimes people will talk about, exercising at a heart rate zone that is, I think, correlating with that kind of cross between aerobic and anaerobic. Again, don't quote me on it, but I know, we often talk to our patients about the right kind of exercise for weight loss versus for fitness training. I think we have time for one more question. Troy, thanks for submitting. Are you getting data on what percentage of fat carb burning based on zones? Recent podcast I listened to doing this type of testing showed athlete-specific percentages based on their zone. So I think the question here is focused on, fat carb burning and whether there's data on that. Is that anything that we're doing here? Or is that more related to sort of the weight loss thing that I brought up?
Yeah, I'm familiar with that sort of subject area as well. And for our purposes, we can kind of extrapolate that based on the testing, but we're not measuring that specifically. Again, like we're not drawing labs and looking at biomarkers and things like that. But from the data we are getting, you can use what's known about kind of the way that your body is breaking down nutrients at different levels to kind of assess that.
Great. Thanks for the question. All right. Well, I think I don't see any more hands up. Justin, Jeff, any last words?
No, I appreciate having the opportunity to speak about our new, our new service line here. And I think, like I said, it's very important to have this tool in our toolkit. I think it's kind of long overdue, and I'm glad that we actually are there now. And I think if I'm not mistaken, we are the only facility on the side of the Hudson River currently, this area. So,
right.
Yeah, so.
But to my knowledge, we're the only people doing it between Albany and New York City. Which is pretty cool. I was going to add. Yeah, I think as we discussed, there's a variety of indications for the test for both, the serious athlete and, non-athlete and everything in between. As I also mentioned before, at some point we'd love to get, groups in or teams in. So if you are interested, let me or Sarah know. Also, if you'd like me to speak to your organization, I'd be happy to do that either in person or virtually. So again, you can reach out to me or Sarah if you have any ideas around that. And yeah, we're just excited to get this going, and thank you all for being here.
Thank you, gentlemen. And I'll be seeing you shortly, Dr. Conway.
Great, look forward to it.
So yeah, we'll wrap up. Again, really appreciate Dr. Conway, Dr. Hulse being here with us tonight. You can actually learn more about our sports medicine department on our website, www.christorunhealthcare.com. You can make appointments with Dr. Conway or Dr. Hulse on our website as well. And lastly, I just wanted to say again how excited I am. This has been a great sort of thought that Dr. Conway came to us with this idea of getting this started, and our operations team helped us put it into place with the help of Dr. Hulse and Dr. Conway. A great example of Christorun, I think, bringing forward latest technology and help for our patients and for our athletes in this case. So I'm really proud of the work that you guys have done here, and thank you for that. And with that, I think we'll call it an evening, and thanks again for joining us.
Thank you, guys.
Great. Thanks, everybody.
Thank you so much.
Evening.